See, it was interesting to see that all the panelists that they talked about, there was one very big common theme. That was about the intent of the partnership. That was about the partnerships to be patient-centric and patient-focused, and about leveraging data to really ensure that we get patient outcomes that are better than that we get today. So I think to me, that's a central theme. Come together, do patient-centric innovation, manage the progress through measurement of data, and leverage big data for better outcomes. I'll talk more about the nature of the partnerships, not taking into names into account, because obviously some hospitals may not like that. But our partnerships go across a various range, right? One big bucket is around building capacity and capability within the training infrastructure. Because as you also heard through the panels, throughout the day today, there's a big need for us to have trained physicians and nurses. Today, there's a big gap that exists there. So that's one big focus for our partnerships around training. The second is around better diagnostics. So we train people and bring technology and tools which help with better diagnostics, be it in the area of GI endoscopy or be it in the area of diagnosing a patient in terms of what kind of a stroke pathway they need to go for. And the third is about at the furthest end of continuum of the partnership in terms of bringing the latest technologies into India and creating centers of excellence. For example, here we could talk about renal denervation for resistant hypertension. So that's the continuum of our partnerships, right from building capacity and capability in the system to bringing newer and newer innovations for improving patient outcomes. I just mentioned two of them, and so maybe just let me expand on that, right? So one is in terms of GI endoscopy. More often than not, through any other means of diagnosis, polyps get missed out, and hence there is a delay in diagnostics of rectal cancer or colorectal cancer. And we all know that if not diagnosed well, that's almost like a death sentence for an individual. So we bring in GI Genius for endoscopy, where we really actually look at polyps that can be detected early if they are cancerous, and timely and appropriate treatment can be provided. The other one is in the case where we actually partner with another agency in terms of utilizing artificial intelligence for a quick and rapid scan of head CTs, so that we can really then give a very clear signal in terms of where does the patient need to go. Do they really need mechanical thrombectomy? Do we really need to send them to a tertiary center? Or they can be managed at the primary or the secondary care center where they have been brought for treatment. That's like the foundational stone of our partnerships, because we can bring technology, we can train physicians, but overall, till the time that ecosystem, and how many times did you hear the word ecosystem today, right? Till the time that whole ecosystem of healthcare is not created, and trained nurses, healthcare professionals, physicians of whatever nature is a big cornerstone to that. So we have our own experience centers also that we run. We also have a lot of training labs that we run in partnership. And we also allow for kind of remote observation of cases through utilizing our technology, where people sitting thousands of miles apart can actually look at a case being performed and learn. Because the best learning comes when we have like-minded physicians who are able to share their learning, and we can bring tools and technologies to impart that training to a whole set of new training physicians. I don't think my advice should count. Advice only counts of like the three panelists we heard. They all talk about the intent and the passion. Every partnership should be started with good intent and executed with complete passion. There'll always be challenges, some roadblocks, but if that intent is right and we bring like-minded people together, we'll definitely see success at the end of the day.